Right, today we're going to be talking about amiodarone optic neuropathy. Amiodarone is an antiarrhythmic that's very commonly used by cardiology. It produces a toxic optic neuropathy that looks extremely like what we call non-arteritic anterior ischemic optic neuropathy. The differentiating features, however, is as opposed to NAION, garden variety, which is usually unilateral, amiodarone can be either unilateral or bilateral. And the disc edema in amiodarone optic neuropathy tends to be insidious and can last for months because it's presumed that there's drug deposition right into the optic nerve that's causing what looks like NAION. In the cornea, we can see the deposition of the amiodarone as a vortex-like keratopathy, pigment deposition in the anterior corneal epithelium. And that is usually the marker that the patient is on amiodarone. So every patient who has NAION, or what looks like NAION, we look at their cornea for the vortex keratopathy, and if they have it, we ask them about the amiodarone because sometimes they don't know they're on amiodarone. They just say they're on some sort of cardiac medicine. So if we see a patient with unilateral or bilateral disc edema, and they are on amiodarone, and they have the vortex keratopathy, we're going to have to call cardiology. And the reason we have to call cardiology is because we cannot be stopping people's amiodarone. This is a life-saving medication. You can't just stop it. And normally when we call cardiology about patients who are on amiodarone, they either say, number one, sure, go ahead, stop it. I think the prescribing doctor has to stop it, not you. Number two, don't stop it. He'll die without it. And so whatever they say, we should write it in the chart. So, in summary, any patient who's on amiodarone can present with an optic neuropathy that looks like NAION. Even if you stop the medication, it can be insidious and can last months. You need to call cardiology about stopping the drug or not stopping the drug, and the key feature in the cornea is looking for the vortex keratopathy. Even if you stop the drug, it might take several months, 5 or 6 half-lives of this washout period for amiodarone, and it can be unilateral or bilateral.